Hello, welcome to Lake Sumter State College Respiratory Care Program Clinical Preceptor Orientation presentation. My name is Adrian Kowalski, and I am the Director of Clinical Education. Lake Sumter State College vision: be the community's college of choice for quality education and career training. The mission: transforming lives and futures throughout our community. Values, which are the 4 C's: care, communicate, collaborate, and celebrate. Lake Sumter State College Respiratory Care Program Mission Statement. The mission of the Respiratory Care Program is to transform students to become competent respiratory care practitioners that assist the community while demonstrating high ethical, moral, and technical standards. The COARC program goal: to prepare graduates with demonstrated competence in the cognitive, psychomotor, and effective learning domains of respiratory practice as performed by registered respiratory therapists. For the program values and statement of philosophy, please see the student handbook. This slide right here is pictures of the respiratory care program staff information. On the left is Miss Katrina Lovelady, who is the program director, and on the right is myself, Adrian Kowalski, who's the director of clinical education. What is a preceptor? They are a leader, an educator, an advocate, an encourager, role model, a socializer, and a protector. A preceptor who has really good leadership qualities. They practice good time management. They coach their students toward excellence in practice. They follow the AARC and hospital guidelines and care. They create opportunities for students to learn. They encourage professionalism, encourage students to have fun and enjoy their work, and they move from a preceptor to a mentor, assisting new graduates in learning. ACORN method. This was a method found by Joyce Hahn, who created this approach on how to handle and manage multi-generational staff in the workplace. Findings of the study was embracing and respecting generational differences can bring strength and cohesiveness to nursing teams and other hospital teams on different levels. An ACORN stands for accommodate differences. Ask students how they learn best and what their concerns are. Tailor their education to meet their needs. Look for growth, not proficiency in the first few weeks. C, create choices. Recognize that certain aspects of patient care can be done in a variety of styles. Provide guidance on education, coach on safety, and hospital policy and procedures. O, operate with a friendly, approachable precept style. Always ask for frequent feedback and also give recognition. R, respect competence. Help the student feel autonomous and encourage recognition of their strengths. N, nourish retention. Make them feel wanted. Help them with socialization with other team members, staff, and doctors. Roles and responsibilities. This can also be located on pages 6 and 7 of the Preceptor Handbook. 1. Clinical instruction. Demonstrate and teach respiratory therapy techniques and procedures to students that correspond to their clinical rotation competencies. Guide students in applying theoretical knowledge to real-world patient care situations. Ensure students understand and adhere to infection control protocols and safety procedures. Number 2, supervision and guidance. Always stay with the preceptee at all times. Provide direct supervision and guidance to students during their clinical rotation. Oversee and assist students in developing clinical reasoning and critical thinking skills. Offer constructive feedback and suggestions for improvement on students' performance. 3. Patient assessment and monitoring. Teach students how to effectively assess and monitor respiratory therapy patients. Guide students in interpreting patient data, such as blood gas analysis and pulmonary function tests. Assist students in managing respiratory therapy cases, including patient assessment, treatment planning, and evaluation of therapeutic outcomes. Number 4, collaboration with the healthcare team. Promote effective communication among students and other healthcare professionals. Encourage students to actively participate in interprofessional team discussions and contributions. Guide students in understanding their role within the healthcare team and the importance of teamwork. Number 5, documentation and charting. Instruct students on proper documentation and charting of patient care. Ensure students accurately record patient data, interventions, and responses to therapy. Advise students on maintaining patient privacy and confidentiality in documentation. Number 6, professional development and ethics. Serve as a role model for professional behavior and ethical practice in respiratory therapy. Encourage students to adhere to professional standards, codes of ethics, and regulatory requirements by the hospital, school, and program. Assist students in understanding and navigating ethical dilemmas that may arise in clinical practice. Number 7, assessment and evaluation of students. Observation and evaluation of students' clinical performance and progress. Provide timely and constructive feedback on student strength and areas of improvement. Assess students' competencies and make recommendations for their clinical progression. Number 8, mentorship and career guidance. Offer career guidance and mentoring to the students. Assist students in setting and achieving their educational and professional goals. Share insights and experiences to help students navigate their future career paths in respiratory therapy. What is inter-rater reliability? This is the extent to which 2 or more raters agree. It's dependent upon the raters to be consistent in their evaluation of behaviors or skills. It's unbiased measurement of student competency. It addresses the consistency of the implementation of evaluation systems being utilized. Why is IIR important? It's because it's part of the COARC accreditation standard requirement. IIR imposes some level of objectivity. IIR provides validation of evaluation results. It certifies skills competency and assigns the appropriate grade. It can also increase confidence that people are following the guidelines in like manner. For example, that a preceptor who has multiple students is rating the same student the same way on the same competency each time. The first clinical day. May 2025 will begin the first clinical rotation for this cohort of students. Please allow the students to observe the RT prior to providing hands-on patient care. Please share opportunities for students to perform and observe treatment modalities commonly found among floor therapy patients, just for the clinical rotation number 1. Please allow the students to double-check physicians' orders, assessments, therapy, or medication changes. Preceptors should always be present with students at all times. Please ask the student to reflect on the day's activities. This would be a great opportunity to discuss any situations that might have occurred. Please allow the student to ask questions for any clarification on anything, and please include them in receiving and giving the shift report. Open communication is key. Give constant feedback, and always end any conversation with the student on a positive note. Here are the references that were used to prepare for this PowerPoint. And just to wrap up, we're really excited that you volunteered to be a part of the Lake Sumter State College family. We're happy that you've chosen to be part of growing the future of respiratory therapy. We wish you the best of luck and hope you enjoy working with the students. Thank you again. This last slide has my office number if you guys need me, and also my email. Please continue the education on Putnam Planner with the 2 videos and a follow-up quiz. Thank you.